What's dysautonomia? This is something that at Carolina Functional Neurology Center, we treat day in and day out. I'm Dr. Walden at Carolina Functional Neurology Center's Raleigh location, and I'm here to answer some frequently asked questions about dysautonomia. First and foremost, whenever patients receive the diagnosis of dysautonomia, they want to know, what does that mean? Dysautonomia means that there is dysregulation in your autonomic nervous system. The autonomic nervous system controls all of the things that we don't need to think about to operate and live on a daily basis. This controls things such as our pupils dilating and constricting, our heart rate, our blood pressure, digestion, breathing patterns, temperature regulation, and so on and so forth. So when patients are experiencing symptoms, it may fall into multiple categories of autonomic control, including difficulties with temperature regulation, high heart rate, difficulties regulating blood pressure, having issues with digestion, feeling short of breath, being light sensitive or sound sensitive. One of the other questions that we commonly get is, if I have dysautonomia, what kind do I have? And while dysautonomia is an umbrella term to say that your autonomic nervous system isn't functioning correctly, there are different domains that you can fall into and different diagnoses that you can fall into under that dysautonomia diagnosis. Some of the common forms of dysautonomia include POTS, which is postural orthostatic tachycardia syndrome. If you're under the age of 18, the diagnostic criteria means that you need to have a heart rate that increases over 40 beats per minute going between laying and standing, and it needs to stay sustained at that point. If you're over 17, it's only 30 beats per minute. One of the other common forms of dysautonomia is inappropriate sinus tachycardia. This is when your resting heart rate is over 100 beats per minute or averages over 90 beats per minute in a 24-hour period. Another form of dysautonomia that we typically see at CFNC is orthostatic hypotension. What that means is that there is a drop in your systolic blood pressure by 20 points, which is the top number, or 10 points in the diastolic number, which is the bottom number of the blood pressure. Another common form of dysautonomia that we see is neurocardiogenic or vasovagal syncope. What happens in this condition is patients go from supine to standing, and their heart rate and their blood pressure both dip, which can result in the individual losing consciousness, also known as syncope. Another question that we always get is, what are we going to do about it? And how do you treat dysautonomia? First and foremost, our job is to figure out where this is coming from in your brain. There are autonomic centers throughout our cortex, which is our big brain up top that we typically think about, and housed throughout different areas such as our brain stem, which is below the brain and controls 90% of autonomic output. So our job is to figure out where this is coming from and then use different therapies to exercise those areas of the brain. So for the majority of individuals with autonomic dysfunction, we are doing orthostatic retraining, meaning that an individual may be on a tilt table. They may be going from laying to sitting, sitting to standing. They may be walking around. And at the point at which they are having a difficult time regulating their heart rate or their blood pressure, we can do different therapies to actually exercise the brain and help create an appropriate autonomic response. That may include things such as peripheral nerve stimulation. It may include cerebellar exercises, eye movement therapy, vestibular rehab, cortical retraining, sensory and motor integration, but it is all dependent on the individual and what their examination shows. Another question that we always get is, how long is treatment? And while treatment varies from individual to individual, this is something that typically we're treating individuals for 6 months to a year. And the frequency and cadence of the treatment is frequent and intense at first because that is what the brain needs to create neuroplasticity. And over time, our goal is to decrease the cadence and frequency that an individual is coming in for treatment so that when it is time to release them from care, there are stable objective measures, subjective measures, and both the provider and the individual are confident that it is left on a call me if you need me basis. If you have any questions about dysautonomia, if you may fit the criteria for dysautonomia or what treatment may look like for you, feel free to reach out to our website at carolinafnc.com.